Medicine is shifting fast, from reacting to disease to catching it earlier, treating it more precisely, and in some cases, preventing it altogether. What should you be doing now to stay healthy? Hi, everyone. I'm Lynn Toman, and this is Three Takeaways. Today, I'm excited to be with Dr. Tom Mihaljevic, President and CEO of the Cleveland Clinic, which is consistently ranked one of the top hospitals in the world and widely seen as a standard center for patient care and medical innovation. Tom is a heart surgeon, and he's helping shape a very different future of medicine. Welcome, Tom, and thanks so much for joining Three Takeaways.
I'm delighted to be here.
When you look at healthcare today, what's already changing patient lives and what's coming next?
Well, there are so many breakthroughs in healthcare, so it's difficult to summarize them in a few sentences. Very few people today die from heart attack, certainly much smaller numbers than they used to in the past. We're really transforming cancer from a death sentence into chronic and manageable disease.
Personalized medicine sounds promising, but when will patients actually feel the difference?
Some patients are feeling the difference already. For example, going back to cancer care, most patients in the United States, in particular being cared for at the large renowned institutions, will have the sample of their cancer analyzed, and we will have the genetic print of a cancer. We will know a specific genetic print of the patient as well, and then we will choose individualized treatment for that type of the cancer and for that particular person that is typically more effective and less harmful to the patient. So individualized medicine is already here. It's very, very exciting because even 20 years ago, all patients were treated the same way, regardless of the type or subtype of the case, regardless of the individual characteristics of a patient. But today, outcomes of women in particular with breast cancer have improved so dramatically over the last 15 years.
That is wonderful. You're working with big data and artificial intelligence and with the company Palantir Technologies. What does that change for patients?
It changes a lot for patients. We rely on big data to guide us in patients' treatment. We now can aggregate and agglomerate the long medical histories, years of treatments, hundreds of blood tests on an individual patient, understand exactly with digital technology what is the best next step in their care by aggregating all of the data, which would be impossible for a single physician to do effectively.
And can you give some examples about how that's improved patient outcomes?
Yeah, oh, absolutely. 15 years ago, let's say if a person were to come who suffers from diabetes for their care and for their checkup, we would need to draw the blood, analyze glucose, blood sugar levels, and then make a decision whether to increase or decrease the amount of insulin that the patient is receiving. Today, we can take a look at all of the glucose levels over the last several months or years. We know what does a patient respond to, how have they responded to it in the past. So the tailored treatment, in particular for chronic diseases, has been transformed by the use of big data. We have actually gotten so used to it as patients, most of us carry our medical records on our phone. So yeah, technology is changing everything, and data are essential.
When everything works the way it should, what does great care actually feel like for a patient?
The great care for a patient would be firstly one that is easy to access. It is still a big challenge for most patients to actually get to a healthcare provider. The second would be the tailored approach, meaning if I have a chronic condition, I would really like a provider to understand a lot about me and to tailor the treatment to my specific needs. And lastly, it would be a healthcare that would be associated with a better long-term outcome so that we can not just live longer, live healthier.
We hear a lot about less invasive procedures. Are we really moving toward a world where major surgery becomes rare?
Absolutely. the transformation that happened in heart surgery. When I began with my training 25, 30 years ago, every patient who needed a heart valve operation had to have a big incision on the chest, stay in a hospital for a week or two, a long recovery, painful. And for many elderly patients, the surgery was not an option, even if they needed it, because it was just too invasive. Today, we can replace very many valves in the human heart without any cuts on the skin of the patients. We can do it with a catheter, and the patient is living in the following day or at the same day of the procedure.
Wow. Will most surgery eventually be done by robots, or is that more hype than reality?
Oh, it is not a hype. My subspecialty back in the days was the robotic heart surgery. 25 years ago, people viewed it as a hype. Today, robots are used so frequently that we have many young surgeons who are actually much more capable of doing a robotically assisted surgery than what we call conventional surgery. There's so much more precision and much less trauma to the patient. The incisions are minimal, half an inch long incisions. It is much, much easier to recover from the tiny incisions than it is to use a conventional 10-inch incision in the middle of the chest, separate the bones and everything else. It was a very, very invasive way to do the surgery. The less invasiveness is well received by our patients.
If you're healthy today, what are the three things you would do right now if you wanted to stay that way as long as possible?
Most healthy people have healthy habits. Nutrition is extremely important. The second thing that is important is physical activity and exercise. And the third one is sleep. So, good nutrition, plenty of physical activity, paying attention to sleep, minimize alcohol, no smoking, drugs, poor food, and lack of sleep.
What do even smart, well informed people consistently get wrong about their health?
They underestimate the importance of sleep. Working hard and being productive at work depends also on the amount of good quality sleep that a person gets. It is good for our cognitive abilities, it is good for our brain health, and it is really important for longevity.
So don't skimp on your sleep.
Don't skimp on your sleep. Very important. It is the best performance drug that anyone can take, a healthy amount of good sleep.
What is one number or signal about your health that people should know?
There's more than one signal of bad health, and some of those signals are not immediately apparent to a person. I always tell to my colleagues, my friends, family, I said, if there's one recommendation that I would give to anyone, do make sure that you do your comprehensive health exam here at the Cleveland Clinic. Typically in a day and a half, we can really assess the patient, the entire team of different specialists, and give a person a comprehensive insights into her or his health, and that is of paramount importance.
How much of what we call disease is actually preventable?
With an exception of genetically caused disease, most of the diseases of modern era are very much preventable by maintaining healthy habits. It doesn't mean that a person shouldn't occasionally have 3 scoops of ice cream or a large pizza, but the overall behavioral healthy patterns need to be maintained over years to really result in good health.
How much of our long term health is really in our control and how much isn't?
Most of our health is really influenced through the way that we treat our own body. We spoke about the physical health, we spoke about the mental health, the importance of sleep, the importance of good nutrition. So it is highly in our domain. There are certain diseases that are outside of our domain of influence, genetically caused diseases, quite a few cancers and so on, but we can influence them by maintaining other healthy habits, and that is to be regularly seen by a healthcare provider. A lot is really in our hands.
Many people today rely on annual checkups. Is that enough, or what should people be doing instead?
I think it is a wonderful starting point, and what is included in the annual checkup, now that changes over time as it should. I'll just use one example, breast cancer. Screening exams are really, really important. For men, it is typically prostate cancer. For both genders, cardiovascular disease. the screening with calcium scoring, which measures the amount of calcium buildup in our heart vessels. It takes literally 2 minutes to do. A very useful screening methodology. I would advise people that at least once every 5 or 6 years, depends upon their condition, that they do their annual checkup, where that checkup is not going to be done by only one provider, but by a team of providers.
What's one question that every patient should be asking their doctor, but almost no one does?
Probably the most important thing that one needs to ask is how much does that doctor or their team, how much experience do they have in the treatment of this condition? And what is to be expected? For most patients, it is an uncomfortable question to ask. If you're seeking help by someone, then to ask them about their qualifications, it's kind of difficult thing to do, where to need a complex surgery or a complex intervention for life-threatening disease, I would definitely ask about the experience of the team, because we do get better if we take care of certain conditions more frequently. And every provider, they are very much attuned, they know what their outcomes are, and they're going to give you a straight answer.
When it comes to screenings and blood tests, where are we under testing and where are we over testing?
I think we are under testing for sure in almost all cancer screenings. A lot of cancers in particular could be prevented if people were to adhere to regular screening guidelines. Generally, let's say compliance for cancer screening for one of the more frequent cancers, like a colon cancer, is only about 30%. So 70% of our population does not undergo regular cancer screenings. What is overutilized in the United States in general is the use of the emergency room as a primary portal for healthcare delivery. Many patients do not act until something bad happens, and then the first destination becomes an emergency room. It is not appropriate site and not effective way to use it for the treatment of chronic diseases that are being neglected.
There's a lot of buzz about blood tests that detect cancer early. Do you recommend those today?
Yes, I do. I mean, there's a variety of blood tests for the screening of cancer. Actually, every year we get some new blood tests for cancer screening. The most important thing is to make sure that you go to a trusted provider for the interpretation of those tests. I cannot tell you how frequently does it happen. You have your blood tests on your phone, and of course there is something that says normal, something that says abnormal, and we get contacted thousands of times every day at Cleveland Clinic by patients who are alarmed because they say, oh my God, I did a blood test and this is abnormal. But just being abnormal doesn't mean that it's not a reason to be alarmed. You need to allow specialists to interpret those findings for you.
Stepping back, when you look at healthcare today, what's already changing patient lives and what's coming next?
Well, there's a lot that is changing patient lives, the advancement in cancer care and advancements in cardiovascular care in particular. So this has had a tremendous impact on patients' lives. What has happened in the past is that vaccinations have eliminated many diseases that were just lethal only 50, 60, 70 years ago. What's coming next? I think we're going to have even greater breakthroughs in the treatment of cancer. An area that we are particularly focused on at Cleveland Clinic is brain health. One of the rising public health care threats as we are living longer now, the new phenomenon of our population growing older is degenerative brain disease, dementia, Parkinson's disease. That is now becoming so common, and I'm sure everybody knows somebody or a family member who suffers from dementia, and we really do not know what causes it. We do not know how to treat it effectively. So we are putting a lot of effort in investigating the reasons why dementia develops in the first place.
How close are we to catching diseases like cancer or heart disease years before symptoms show up?
We are already there. Let's just take two very concrete examples. Genetic screenings for breast cancer. We know that if a woman carries a certain gene or gene mutation, they're much more likely to develop certain types of cancers, not just breast cancer, but sometimes breast and ovarian cancer. So in that case, we can treat a patient ahead of time. So many people underwent a prophylactic, meaning earlier removal of their breast tissue just to prevent themselves from developing a cancer, because the likelihood over a lifetime goes up to 70%, which is really, really high. The other thing that we're doing is we're actually developing new vaccine against certain types of cancer. So people will be able to be vaccinated if they belong to high risk groups. And those vaccines would create an immunity against the cancer type that they may be susceptible to. So we are trialing the breast cancer vaccine for the most dangerous and most lethal form of breast cancer. For heart disease, the calcium screening that I mentioned, for the first time, we have a method when we can take a look at the status of the blood vessels on your heart. And those blood vessels, if they get clogged, they cause a heart attack. So in the past, the only way to look at it is actually to have the procedure done. It's called a catheterization. But today we don't have to do any procedures. It's a 2-minute CAT scan. You can take a look at your blood vessels and tell you whether you have any evidence of calcium, meaning thickening in the blood vessels or not. And those type of tests can warn us about the development of disease years before it really starts causing trouble.
Where can one find Cleveland Clinic facilities?
We have about 307 different locations around the world, 25 hospitals. Most of them are around Cleveland. However, we have a growing presence along the southeast coast of Florida, from Fort Lauderdale all the way up to Indian River, soon also in Palm Beach. And we do have internationally hospitals in Toronto, Cleveland Clinic London, and then in the United Arab Emirates, the largest and the best hospital is Cleveland Clinic Abu Dhabi, and in Las Vegas as well.
Good to know. What are the 3 takeaways you'd like to leave the audience with today?
I think it is important for people to understand that their health is really in their hands. Those healthy habits of healthy eating, physical exercise, and a good sleep will keep doctors away for a really long time. So the first recommendation, keep your healthy habits. The second one is make sure that you see your doctors at least once a year. I would say at least once in every 5 years, do make sure that you have a comprehensive evaluation of your physical health, your larger system. And the only third thing that I would say, as any doctor would say, stay away from bad habits. So as simple as that.
Tom, thank you so much. And thank you for the great patient care at Cleveland Clinic.
I enjoyed it. Thank you.